in San Francisco to bring you the Technical Assistance Centers on Caregiver Programs and Lifespan Respite, which are funded through the Administration for Community Living, the Administration on Aging. The Family Caregiver Alliance brings a wealth of information and research on family caregiving issues, and I encourage and invite all of you to visit their website at caregiver.org. We are also very honored today to be joined by Greg Link, who is the Federal Project Officer for Lifespan Respite and the National Family Caregiver Support Program. He's based at the Administration for Community Living and the Administration on Aging, and he has offered to very kindly offer some words of welcome. So go ahead, Greg.
Thank you, Jill, and welcome everyone who's dialing in to listen to and learn from this important webinar on funding sustainability. We're wrapping up the third year of program implementation, and many states who were among those first grantees are looking for concrete methods for ensuring program sustainability beyond federal funds. And so this second webinar is an important component of providing grantees with the tools and resources that they need to ensure sustainability of their programs. And so I look forward to the information that's presented and hope that it has broad applicability and usage, not only for the Lifespan grantees, but also for other programs who are looking to ensure sustainability beyond funding from other public sources. So with that, I will turn it back over to Jill. And again, thank you all for listening into this webinar.
Thank you very much, Greg. Just so you'll have a sense of how we're going to progress today, I want to very quickly introduce our three presenters who are affiliated with three different Lifespan Respite programs. The first presenter is Roseanne Percival. She's the Community Partnerships Coordinator at the Center for Learning and Leadership at Oklahoma University Center on Excellence for Developmental Disabilities. Susan Robinson, who's the Director of the South Carolina Respite Coalition, and David Best, Caregiver Support Specialist in the Arizona Department of Economic Security, Division of Aging and Adult Services. ARCH's first webinar on funding sustainability, as Greg mentioned, was presented by Laura Martinez from the Finance Project last May. And the goals of that webinar were to provide a framework that Lifespan Respite grantees or other respite programs could use to design their own sustainability plans, to help grantees and others consider how to benchmark their progress towards sustainability, and finally to provide some very interactive and hands-on tools that would help the development of a strategic financing plan. If you were not able to listen to that webinar, part one live, or if you did not gain access to those interactive tools I was talking about, these materials are archived on the ARCH website at archrespite.org. Also, as Greg mentioned, we do have the Federal Lifespan Respite Program that we're going to be focusing on today, but much of the information is applicable to other funded programs as well. But the definition of lifespan respite, as it's defined in the law, are as coordinated systems of community-based respite for all family caregivers. Inherent in this definition is building an infrastructure or a system that will stand the test of time while also improving access to otherwise fragmented respite services in each state. So coordination in this context is dependent on solid partnerships between those who represent or administer state and local respite funding sources and service streams. Lifespan Respite's foundation is built on this collaboration, and it really cannot exist successfully without it. Of course, all of this is much easier if the fundamental building blocks, those funding sources that support the system, are secure as well, and that's a bit more difficult, especially in these economically challenging times. That's what this webinar is really all about today, to get some practical examples of partnerships and funding sources that other states have utilized to sustain their lifespan respite systems into the foreseeable future. Before we get to hear from our presenters on their more in-depth examples from their individual states, I just wanted to call attention to the ARCH guidebook on federal funding and support opportunities for respite. In this guidebook, we identified over 60 federal programs that can either assist families in paying for respite or help states build respite capacity by starting up new programs. There are also funding sources that support training opportunities for respite and other direct care workers, as well as the very infrastructure systems of lifespan respite that we're talking about. Now, not every, of course, that sounds like a lot of federal funding for respite, but in fact, in most states, these funding sources are not being used for respite. They represent potential funding sources. And while they do that, if you can identify in your state who are the folks who are responsible for administering all these disparate funding sources, then you also have a blueprint for identifying potential partners who can help you build or sustain a lifespan respite system. Just to provide a few examples, I wanted to highlight some of these funding sources that are discussed in the federal guide. Many of them you may or may not be aware of, and they may or may not already be funding respite in your state. The first one that I find very intriguing, and I believe to my knowledge is only being used by one state to fund respite, is the Child Health Insurance Program, which is a rather large federal program that was enacted in the 1990s and strengthened as part of the Affordable Care Act, the health care reform legislation. And the purpose of this program is to provide health care coverage for low-income children who do not qualify for Medicaid and would otherwise be uninsured. And states can elect to provide coverage to qualifying children either by expanding their Medicaid programs or through the development of a state program separate from Medicaid. An example of a state that took advantage of the flexibility a state program could provide is North Carolina. And this was back in the 1990s when the program was first getting started. The North Carolina Child Health Insurance Program, known as Health Choice, worked with the North Carolina Respite Coalition at that time, and they developed a separate component for children with special health care needs with a range of service benefits. And one of the benefits they made sure to include as part of this additional coverage was emergency respite for these children. And so that's a rather unique use of federal funding. The second one I wanted to highlight is a program administered out of the Department of Housing and Urban Affairs, the Community Development Block Grant, which is available to states for the purposes of enabling local governments to undertake a wide range of activities intended to create suitable living environments, to provide affordable housing, and otherwise create economic opportunities, especially for people with low or moderate income. One of our programs, our ARCH member programs in Nevada, the Give Me a Break Community Respite Program, which provides respite provider training and a 24-hour statewide respite information toll line, as well as community respite days. Until recently, this program did receive annual funding from the City of Las Vegas Community Development Block Grant Funds to support its respite services. The third one that I specifically wanted to mention is the Social Services Block Grant, which more of you may be quite familiar with. Gives states wide latitude to fund a very broad range of services and directed at several very broad goals, one of which is to prevent neglect or abuse of children and adults, and another one to prevent or reduce institutional care through home and community-based services. Most states use at least some part of their Title 20 Social Services Block Grant funding to serve the aging population and individuals with disabilities, including funding adult daycare and respite. And one very interesting example of the use of this funds is in Missouri, where respite services are provided at the Missouri Disability Resource Association which is actually the federally funded Center for Independent Living, so that's another important partnership. They use SSBG funds to provide respite for clients who are over age 60 or individuals with disabilities who are over 18. And the respite is really intended to offer caregiver relief for longer episodes than might otherwise be available through other funding streams, but is also largely made available for those who don't qualify for other funding streams in the state. And I offer just these few examples because I want to entice you to take a closer look at the ARCH Federal Funding Guide, where you'll find information about the Senior Companion Program, about the Community-Based Child Abuse Prevention Program, respite programs offered through the Department of Veterans Affairs for veterans, military child care through the Health Resources and Services Administration's public health programs. So it's really an opportunity to get you to take a closer look at that guidebook. And we also did send around some other concrete state and local examples from the guidebook earlier today when we sent around the PowerPoint presentation to you in advance of the webinar. And finally, we're going to hear, as I said earlier, from 3 states about their lifespan respite programs and how they have funded them, how they plan to fund them in the future once their federal grants through lifespan respite are expended. But I wanted to highlight just a few examples of these as well that we wouldn't hear about today otherwise. I'm very frequently asked about how to fund the infrastructure of a lifespan respite program. And the states that have been doing this for the last 10 or 12 years have largely relied on state funds. But in Nebraska, they've been a little creative. The Nebraska Lifespan Program, which has been around since 2000, is composed of 6 regional networks that are responsible for recruiting and training providers, for matching families to providers and funding sources, and other respite-related activities. And to fund their network infrastructure, in addition to state funds, they have used federal administrative Medicaid match funds and funds from the Individuals with Disabilities Education Act, the Part C Early Intervention funds that are available through the Department of Education. So again, that's an example of a state that has thought creatively about ways to fund administrative costs. In the Money Follows the Person program, states receive an enhanced Medicaid match for moving individuals from nursing homes and other facilities back into the community. We know that, of course, that for many of these individuals, they're going to rely on family members to provide the support they need to live in the community. And some states are allowing funds saved as a result of this initiative to be used to support family caregivers. And the North Carolina Lifespan Respite Project, specifically in its efforts to sustain their project beyond their initial grant period, has partnered with their state Medicaid agency to use the North Carolina Money Follows the Person Rebalancing Fund to support a new family caregiver peer support model where family caregivers will be able to help each other to find respite and other supports. And the last one I just want to talk about briefly because it's a program that relies on voucher delivery, and that's in Tennessee using various state and private funding streams, including state mental health funds. The Tennessee Respite Coalition has been running for some time now a family-directed respite program. Caregivers are given control over who they hire to provide respite. They're given a bank of funds to access through vouchers, but the eligibility criteria still remain dependent on the original funding source requirements. And these kinds of models, we're going to hear more from Oklahoma later, but other states have used voucher programs similarly to streamline respite access for families and have relied on existing funding streams that are already there in their states to sustain these efforts. And these examples were featured in case studies in ARCH's participant-directed respite guidebook that was prepared for us by the National Resource Center on Participant-Directed Services. This report can also be accessed on the ARCH site, so if you're interested in going into more depth on how to move forward and sustain your program through the use of vouchers, I commend that work to you. We are very privileged today to have someone who was instrumental in this whole concept of a voucher system and funneling different respite funding streams through a single voucher program, and that is Roseanne Percival. She's currently the Community Partnerships Coordinator, as I mentioned earlier, at the Center for Learning and Leadership at Oklahoma's USED program, but she is also the founder and the chair of the Oklahoma Respite Resource Network, and started this whole process when she was back working for the State Department of Human Resources. So I'm very privileged to turn the first presentation over to Roseanne.
Well, good afternoon, everybody. Welcome to this, and we are just so thrilled in Oklahoma that we're not 112, that we don't hardly know what to do. I was asked to speak on this, and I'm not going to go through everything on all of these slides, but I laugh and tell people that basically there were about 3 of us in the basement of the Department of Human Services building plotting the overthrow of the Department of Human Services. But instead, we decided to take on respite. In looking at assessments and needs assessments from across the state, we found respite was one of the most requested services and one of the most inaccessible services in Oklahoma. So we basically started meeting, and we contacted Arch. I think Maggie, is on the line, and she came and helped us do, we did a strategic planning session. We got the Arch funding guide, and we used that guide to figure out who to invite to the table. And so we held meetings, and from '97 we actually formed the Oklahoma Respite Resource Network. As you can see, it took us 3 years to kind of issue our first voucher. Next slide. So what we had to decide first is what we wanted. And we knew that we wanted a simple respite application process, vouchering process that was very easy for families to participate with, to not have to fill out an 8 or 9 page application. Ours was front and back, and really only about 3/4 of that had to be filled out. We wanted one place people could call for respite and not have to call each and every individual agency in Oklahoma to try to find out where they could get respite. We also decided to take a stand that we wanted the family or the caregiver to be the employer of record, to set the rate of pay, to be able to negotiate and use as much of their voucher as possible in the most cost-efficient way, and the better they negotiated, the more respite they got. We also talked to Department of Human Services to act as our fiscal intermediary, and they agreed to do that, and they didn't charge any administrative costs. So if we went to the health department and said, you need to join in if you give money into respite, DHS is not going to charge you any administrative fees. So every dollar you give us will go to respite care for families. We also wanted to continually do little simple satisfaction surveys so that we could keep on top of what families wanted and whether what we were doing was what they wanted to. Next slide. So we adopted a mission, we developed the lifespan presentations, and we target it to aging, we target it to child abuse prevention groups, we target it to children with special health care needs. We went out everywhere we could, and we developed specific fact sheets, caregiver statistics, benefits of respite, so that we really focused on each and every piece of the lifespan in Oklahoma. And we were very fractured. Our funding was very fractured, and it took a while to figure out kind of where all that goes. We did a video to show, we went out and interviewed caregivers so they could tell their story, and we didn't have to tell it for them. We could put on a video, and people could see the emotion and all of the things that benefited people on that video. We also produced a brochure to really outline how people applied, where all that went. Next slide. Please. I'm sorry, I forgot to say please, Jill. So we went out and we just made appointments with the Commissioner of Mental Health, the Commissioner of the Department of Health. We went to the Director of the Department of Human Services. We went to our Medicaid agency, but we weren't real successful with our Medicaid agency because they don't think it fits the definition of medical necessity. So we are still working with them on that and still trying to educate on how this prevents and saves money and helps support families. Our finance division at DHS agreed to develop and work with the respite voucher system. The only time they'd ever done vouchers was for clothing, for foster care, but they were willing to try this out and give it a shot. So, you know, we got formal endorsements from a lot of different disability organizations, family organizations, and then we conducted a pilot. We got a foundation and DDSD, so we pulled together about $65,000 in order to be able to do a pilot, because we all know that with a little bit of data, you can go a long way. So next slide, please. So this is kind of where we started with our funding. We started with 2 foundations that gave us a total of $35,000. DDSD put in $30,000 for us to do our pilot with, but then all of these organizations have stayed with us. So DDSD put in money and they used state money, but we got 50% federal match through the administrative funds. Okay, the Aging Services Division came in big time with the Older Americans Act and have stayed steady, have been there, and have really been our foundation over the course of the years. Title V in Oklahoma is split between the Department of Human Services Children with Special Health Care Needs and the Oklahoma Health Department with their maternal and child health and their Office of Child Abuse Prevention. So that's split in Oklahoma, but we got both groups to be able to commit to providing funding for this. In Oklahoma, our TANF dollars, we were able to, our governor at that time decided to do a marriage initiative, a way to strengthen marriages in Oklahoma. And even though we're in the Bible Belt, I think we're still pretty much close to the top at the divorce rate in the United States, and especially with families that have children with disabilities. So they were doing a marriage initiative. So we put in a proposal from the Respite Network to be able to serve families, you know, 2-parent families that were raising a child with a disability. Now it also included aunts and uncles and, you know, married grandparents, so we were able to use that money. In mental health, we call it, it's from the wraparound services money where, and this is for children, where you look at the entire family and try to wrap services around that family. In Oklahoma, we call that systems of care. And then our last bit of funding was, you know, coming from the Lifespan Respite grant. So we had some other foundations come in and help us fill in some of the gaps. And with the Lifespan Respite grant, we wanted to be able to serve those people that didn't fit any of these other categories. We had a lot of people out there that had traumatic brain injuries, that, you know, people that didn't have an intellectual or developmental disability, but were still having to be cared for by a family member. Okay, next slide. So this is how it worked all the way up until last year. We had that one call, and I'm not going to go through this a lot, but most of that still works except the OASIS part. And so we've gone through some changes, and if we can go ahead and go to the next slide, I just wanted to show what the process looked like. And what happened lately was that we got the Lifespan Respite grant. Aging came up with some really innovative ways to do that, and Aging took the lead in Oklahoma in applying for the Lifespan Respite grant. We've survived a lot of major budget cuts by showing people the validity, the cost efficiency of respite and how it supports and helps keep kids at home, you know, prevents institutionalization, all those kind of things. You know, we've been able to survive without major cuts, except we did have an issue with mental health and the health department for a little bit, but I think if once we figure out what we're going to do, because of the change in OASIS, OASIS had to reorganize and went under another agency, at the OU Health Sciences Center. So they're no longer able to do sending out the applications, receiving the applications. So the other funders have just taken upon themselves, with the leadership of our aging division, to do the applications and all the approvals. So we just kind of cut out OASIS. Although OASIS agreed to keep the 1-800 respite number for 6 months, so that when people call, we can direct them to the new place to do that. So we're in the process of kind of re-looking at revitalizing the Oklahoma Respite Resource Network. We kind of went dormant for a couple of years because we thought we had kind of accomplished what we needed to accomplish, and a lot of the people retired. And so we're looking back at revitalizing that. So next slide. We are very much involved with the Aging and Disability, we call it the Aging and Disability Resource Consortium in Oklahoma, and we are working very closely. We were hoping that OASIS would not have to reorganize until we got things online with our Aging and Disability Resource Consortium here in Oklahoma. We do want to incorporate the respite voucher system into the ADRC information and the web portal, so that when the 1-800 respite number goes away. Now, OASIS is still providing referrals to the proper parts, but once we get the web portal and all of the things going with ADRC, we think that'll be a natural fit, but we're having to work on that right now, and we're meeting regularly with the ADRC to try to figure out how to do that. Something else down the line is that we're looking at electronic benefits transfer cards, and that's a program where, we already do TANF in Oklahoma with electronic benefits cards. We do daycare and a lot of other things, and our state finance department wants everything done on these EBT cards. So when somebody calls and we approve respite, we simply send them a debit card with the amount of respite that was approved on that debit card. They can go to an ATM, withdraw the money, and pay their provider right there. Under the old system, or the way it's doing now, it takes about 10 to 16 days or so for the provider to get their money back, but that's still a lot better than the 6 weeks to 9 months that it takes to take it through the state payment system. So the EBT will further reduce administrative costs. Our finance division will no longer have to handle paper vouchers, but we can do this all electronically. Next slide, please. So Jill wanted me to talk a little bit about how we've kept that going. For 10 years, we met 6 to 8 times a year. We knew that we had to develop some kind of efficient physical system so that once we got it going and got it embedded into the administration of a large agency like the Department of Human Services, we knew that it would continue. We knew we wouldn't have to work that constantly, to make that keep working. It doesn't require a lot of maintenance in order to do that. We've kept administrative costs to a minimum. When we go to agencies, when we go to foundations, we can still say, if you give us money, every dollar will go to family members. The Department of Human Services is not going to take a cut. And, we've kept a simple application and renewal process. And like I said earlier, our funding agencies have really seen the benefits of providing cost-effective respite care. We've done our surveys, and our satisfaction rating was running 97%. A lot of that time, people felt like it made them a better caregiver. It felt like it benefited their family. We talked about, did this help your marriage? A lot of people said yes. And so we've had the facts to take back when budget cuts were coming or different program changes were coming. We could still show the benefit of the program. And number one, we still have passionate people involved. Eleanor Kurtz and Bonnie at the Department of Age, our Division of Aging, has just done a wonderful job. They've all seen the benefits of this. We still have passionate people involved in our Title V programs and in the DDSD programs. We've not suffered any major cuts in any of those. And I think number one, we trusted caregivers and families to find the respite providers and train them. And if families didn't have somebody in mind, then we could refer them to any of the 50 to 150 agencies in Oklahoma that either provide home health care or provide developmental disability services. Now, it costs them a little bit more to do that, but it is a way to go. So we never had to build that system of recruiting and training providers, and we probably only had like about 4 to 5% of families that have needed some additional help in finding somebody to take care of their loved one. Next slide, please. And when people say, well, you were really lucky to have a state agency be your fiscal intermediary, you know, it doesn't have to be a state agency. You need to find somebody that might be able to do this for you and charge, you know, not a major amount of money out of, you know, administrative costs. It does help because they have the best resources. And, you know, we've had to change numerous times and adapt over the course of the year, and I think as long as you are able to do that, you just come out stronger each time you go through a change. We continue to look for partners and new ways to provide respite. And our Lifespan Respite grant agent came up with a great idea of a mobile respite program that, you know, we're working on, and through their connections there was a way to, you know, look and, you know, buy a used van that could, you know, be used for that, and looking at using the gerontology program at the University of Oklahoma Medical School, or college, pardon me, don't want to say school, in order to, you know, work that now. You know, that's something that I think they're still working on and will continue to. But, you know, you just have to be creative. You have to have a passion for your cause. So, next slide, please. So, just be creative. You know, and I've already talked about the aging services, you know, and if you build a stable system with committed partners, it can adapt to change, you know, that's what you have to do. You have to not get so tied up in, this is the way we've always done it. You know, do satisfaction surveys, do a cost analysis to support your mission, and I don't see why you can't be successful. Like I said, Oklahoma has maintained for 12 years now, and I don't see any reason why it should come to an end. So, thank you. Did I do it in the amount of time I was supposed to?
That's wonderful. Thank you very much. And this is Roseanne's contact information. If you want to reach out to her, this information was included in the slides we sent to you earlier, so you don't have to rush to write it all down. We'll move to our next presenters. Susan Robinson has served as director of the South Carolina Respite Coalition, part or full-time since 2001. Most of her years of experience are in the aging field or volunteer administration and human services. She's also had first-hand caregiving experience as the parent of 3 adult children, one of whom was adopted internationally and has special needs. And she's also cared for her father, who developed dementia in his last years. We're also very lucky to have with us Reverend W.C. Hecka. He's on the line today. He's not going to be presenting with Susan, but he will be available to answer any questions at the end of the presentations. Reverend Hecka is founder of the South Carolina Respite Coalition and is currently the director of the federally funded Family to Family Health and Education Center at the Family Connection of South Carolina. And Family Connection is a significant partner in the South Carolina Lifespan Respite grant. WC is our go-to man on a number of issues. He's a national trainer in fatherhood, respite, marriage, faith-based initiatives, and prevention of maltreatment of children with special needs. So we're really fortunate that he's available to us as a resource today. So go ahead, Susan. And thank you for being here.
Thank you. Why did you make me follow Roseanne? Hard act to follow. As implied by the introduction Jill gave, the South Carolina Respite Coalition has been in existence since the late 90s. It was incorporated and spun off Family Connection Incorporated in 2001. It became its own freestanding 501c3. And we have done, our fortunes have waned and ebbed greatly through the years. We have done as much as we could with very little, and we've had donations from our partners for space and meeting rooms and discounts on phone equipment, and grant, a grant here or there, or used equipment has been donated to us, and that's helped us to keep going without a lot of steady funding, stable funding. There were no formal agreements. There was sort of hopes at the beginning that the partners would all give small grants to sustain the, to support the administrative costs of the coalition. But no sooner did we get incorporated than all the state agencies in particular began having cutbacks, and those funds didn't materialize. So a great deal of it has been in-kind and just in relationship sort of overtures and cooperation through the years. And I would say, as I think is implied very heavily in Roseanne's presentation, that relationships are at the core of it. Passion and dedication and relationships with people. We have done our best to build bridges and coordinate existing services. We have not provided respite vouchers at all, in direct contrast to what Roseanne has just said about OASIS. We have tried to make sure that they were not duplicated, and that people in mental health providing services to families, caregivers with children with emotional disorders knew about what Family Connection was doing and what the other organizations were doing to particularly bridge aging and children. I've always surprised families by saying, have you called, you can't find a provider when they were ready to hire an individual to provide respite. They might have even had money to do it. I would ask them if they had called their local senior center. And that's just a new idea. And as Roseanne said, you have to think outside the box and make these linkages that people may not naturally and easily do. We are trying to move into using more technology, and our partners have offered to help with some of this. I'll go into that in a minute. And then we have done a lot of outreach to faith communities. We can't even document all that might have happened and transpired because of it, but we have continued to try to raise awareness among faith communities and present models to them of respite and talk about inclusion as really the first thing that they can do to keep a loved one coming, and then the family caregiver can go to their own church services or adult Sunday school classes or whatever. In South Carolina, it's silly not to do that because there's a church on every corner, and most people are affiliated with churches and look to them for support and care and ministry to them when they're in need. And sometimes churches are even donors to us. A church has just focused on us for a month and gave us almost $800 towards vouchers just from their collection, an extra collection every week they did for a month. So we are asking, we are asking them to donate money, and we're asking them to raise money for vouchers and ministry to family caregivers. So that's a huge pillar in our work and outreach in South Carolina. Next slide, Jill. The focus of this is to how we're going to sustain our coalition and our work in respite without a Lifespan grant. But certainly this Lifespan grant has breathed new life into some of our partnerships and reconnected us to old friends and kind of forged new ones. We're really pleased to be working with the Veterans Administration, and we give a lot of credit to our partners and to the Lifespan agency that's got the Lifespan grant, which is our Lieutenant Governor's Office on Aging, because they have been working with several grants with the Veterans Administration. The advisory council that has come out of the that we call it the Respite for the Lifespan grant, that group has really become committed to this cause, and as they've participated in task forces to write a respite state plan, they are now eager to see it implemented. And so with or without future funding, they want to remain with us to work on it and see these ideas brought to fruition. And ideally, the Respite Coalition or a central respite entry point, much as Roseanne has talked about, where families really can get information and get right to the right source of respite for them, even if the Respite Coalition isn't the main source of their vouchers. But, you know, we want to make their path to finding respite as easy as possible. So one of the central ideas is that we will have web information and a phone contact point for families so that they can quickly get to respite. We are establishing regional advisory councils and including family caregivers and providers in that, they will advise our board and advise, you know, the statewide advisory council in implementing and making applicable the state plans for their part of the state. Next slide, Jill. We have been doing cross-training between the Aging and Disability Resource Centers, information specialists, and the parent partners that are working at the grassroots in the Family-to-Family Health Information Network, and we're making plans to continue that. We've already got tracking of referrals, which serves not only to keep a little data on whether they have referred back and forth when they heard from a family that belonged in the other network or could access services in the other network, but it, you know, whenever they make a report, that triggers or reminds them, oh, yes, I need to remember to make those referrals. We have realized that we haven't done enough communication, though, and cross-training. We want to continue that, and the other day we're talking about creating a sort of two-sided cheat sheet, if you will, information sheet. One of the things, and this is probably true in other states, but I mean, no state agency in South Carolina has the same regional structure. So you can tell a family that, you know, oh, well, you can call the ADRC and speak to someone in the Family Caregiver Support Program in Region 10, and it means nothing to them. And we realized that we needed to, you know, have those districts, those regions mapped out for the aging network and the contact numbers for the ADRCs, very clear on those, and then on the other side, the same kind of thing for where the parent partners are working. So we are developing that. Next slide, please, Jill. And along those lines, I'm going to go to the second item on this slide, but we have realized that some strengthening of this partnership between ADRCs and the Children's Network might be better done if they know each other and see each other face to face, and, you know, find out who they're related to and which high schools they graduated from and which football teams they support. We realize that we need to create some local relationships. So we are going to be looking at trying to have local meetings, and the Respite Coalition will we use its donation money or perhaps get a church to host a lunch. You know, frankly, staffs have become so busy, they tell me they hardly even have time to go to lunch. But if we can induce them with some food, we thought that the exchange and the meeting each other and telling each other about the respective services of their network would be helped along by local meetings. And we realized that one of the outreach goals that would be quite appropriate for the family partners will be to go and visit ADRC staff people at least once a year to tell them about the early intervention programs for 0 to 3-year-olds, and that will be a way of them having another face-to-face. We have had successfully recently sort of discounts for staff people in aging to attend the Children's Hopes and Dreams Conference for the parents of children with special needs. And that proved to be very successful. And exhibiting and exchanging exhibit booths without charging a fee has been something we have promoted. And that, too, was illuminating. The people at the Office on Aging were quite accosted the first year that they did this at the Hopes and Dreams Conference. You know, they learned firsthand, and I'm sure many knew it already, but I mean, they really commented on it. What we've always said is families don't come in neat packages with, you know, just interested in autism or just interested in mental illness or in aging. And people were coming over to their table asking, saying, you know anything about Alzheimer's, or what is this family caregiver support program? And so the cross information there was very good. And of course the staff also attended workshops and got ideas for bringing people to the Aging Network workshops. So that was very productive, and we plan to continue that. Next slide. And to connect the regional advisory councils that we are forming, and some are already formed, we are going to be trying to do better with technology. Our South Carolina Disabilities and Special Needs has, it turns out, they've only recently offered it to us at no cost, but at 5 locations in the state, we could have our video conference meetings and trainings, and presumably record some of them so that we can continue that. You know, for new staff members, we could refer them back to a training we did. The Lieutenant Governor's Office on Aging has go-to meetings that we use and will continue to use. We have had a website for quite a few years now, the South Carolina Respite Coalition, and we link to other organizations. We're not trying to keep up all the materials that Family Connections developing or other organizations are developing, but we are directing and linking to those resources. We realize that the website needs improvement. We've done it on very few dollars, and one of the consequences of that is that we haven't really been able to have fundraising and donations online, and we have had a secure platform for getting conference registrations, but we need to improve that. So very definitely we are going to be working on upgrading our website and having more links on that, more information. Next slide. And back to the faith community, a very important pillar. You know, as I said, we have a wealth of faith communities and family involvement in them. You know, we know that families want their own family members to provide the care to loved ones if they can get them to do it. And they don't want strangers particularly, but one of our slogans is that the faith community is next best to kin. And you know, we discuss that. You know, sometimes people say, well, they don't want a church member to come in and see how dirty their house has gotten because they're so preoccupied with caregiving. That may not work, but, and we've had faith communities say, you know, if we open this up for one family and we can't do it for everybody, that's going to be a problem, and they're going to criticize us. But I think that despite those reservations and those real issues sometimes that I hear, we are very invested and feel as though faith communities can sustain and will provide some of the sustainable respite that we can develop in South Carolina. And some of that is going to be volunteer respite, I think. With a new grant that we have recently received, it's not a large grant, but it is from the Alzheimer's Resource Coordination Center here in South Carolina. We will have a little bit of money to travel and do public speaking to faith community leaders. I was an exhibitor and participant at the Parish Nurses Conference. It's called the Faith Community Nursing Conference, and it's a growing and soon-to-be incorporated organization in South Carolina. But we want, with this new grant, particularly to talk to the gatekeepers, the people who do visiting in the home, the people who are aware when a family is in crisis, Stephen ministers who counsel families. We want them to really understand how difficult it is to be a caregiver and to be very insistent that they're not going to walk this alone, and to get help early, to use some of the arguments that it's as good for your loved one to have other people know how to take care of you and know you and see you and be friends with you. It's not just about the caregiver, it is about the loved one as well. But most important message that we are going to bring to them is that the family caregivers need to start using respite early, way earlier than they know they need it, and teach them some of the things that that they can do. Next slide, please. One of the things that we will talk to them about if they're interested is our respite models. You know, we have had people say, well, we really know what family caregivers need. We hear these husbands and wives taking care of someone with dementia or a daughter that's burning out, but we don't know what to do about it. And so we have a little packet that we give, and we will brainstorm with them what's worked, what they've tried, small things that small churches can do, and on up to large congregations. One of the reasons I asked WC to join us today is that he has written a benevolence policy, which is not as simple as it would seem on the surface, but basically a church collects a pot of money and gives it away to the family caregivers in their congregations who need respite and manages that fund. If they are doing ministries already, say they have a Mother's Morning Out program, but they don't have enough elders who need care, is there any way to recruit some shadows to enable a couple of older people to be there with the children, perhaps even interact with the children, and be served by the Mother's Morning Out? Could it change names or be expanded? Could they be brought there as volunteers in some way? You know, thinking outside of the box and looking at what they already do that could be expanded. Very obviously, church Bible schools, I've got a flyer that I distribute challenging and inviting the planners of church Bible schools to include children with special needs in their Bible school, and to start early in the planning and bring the parents in on, you know, training their volunteers how to be involved and take care of their children. But these are the sorts of things that we are talking about, you know, talking to faith communities about. And then if they're willing, if they've got a successful program, if they're willing to be held up as a model and as a mentor and show a neighboring congregation how to do it, great. We're going to ask them if they will do that, and we do ask them if they will be mentors. And then the other piece of what we're doing is we know that a champion is what's needed in most organizations and in most faith communities. to start these programs. And so if we can get family caregivers to take some of our materials and some of our ideas back, get us invited to come and speak, or just talk from their heart about what they need, then perhaps they will be instrumental in getting their faith communities to begin looking at respite in new ways and starting respite ministries. So South Carolina needs your good thoughts and ideas. Thank you for having us on this webinar.
Thank you, Susan, and here is her contact information. I'm going to move right along to our next speaker. I urge you to stay on the line because this is going to be a dynamic presentation from David Best, who is the Caregiver Support Specialist with the Arizona Department of Economic Security in the Division of Aging and Adult Services. David is the program manager for the Lifespan Respite grant in Arizona, but he goes way back even before that, a champion for Lifespan Respite. I think we first met in 2005 or 2006 when he was working with the Arizona Caregiver Coalition to build a state lifespan respite system, and was quite instrumental in helping get some legislation passed in Arizona in 2007 to make it a reality. So welcome, David, and we welcome you to start presenting.
Thank you, and thank you all for joining us today, and certainly thank you to the two previous presenters. And I must say that Arizona is kind of the new kid on the block compared to the Oklahomas of the world, and I really enjoyed hearing some of the things that Roseanne and Susan shared, because they're commonalities to the past, and I think that's one of the messages from this webinar, is that we can all learn from each other as we travel this path that's been, I think, reasonably laid out for us through the Lifespan Respite program and the federal guidelines that we're working under. So as far as our program here in Arizona, as Jill mentioned, we did get started in about 2006, and we really, our recognition of this is correlated to the National Lifespan Respite Act that was signed in 2006, and we had some really good active advocates here in Arizona, and that was right when I was coming to work for the state and running the Family Caregiver Support Program, and we were already talking about putting together a caregiver coalition to support what I was going to try to do through the program. And we were approached by some advocates that were actively pursuing legislation in Arizona for the Lifespan Respite Act for the local state bill. And they had modeled it right after the federal act, and it called right in the language of the bill for a coalition to be to work, that the state was to work with a coalition. So there was a synergy there, and we put those two together, and instead of having a respite coalition and a caregiver coalition, we put them together into one, the Arizona Caregiver Coalition, and we made sure that respite resources were a key function as we moved forward. Unfortunately, we did run into some things in 2008 after we were funded in 2007 through our state bill, that some of the fiscal crisis impacted that funding, and luckily, and the timing was very, very good in that we were able to apply for the federal grant, and were lucky enough to be awarded in the first round of funding in 2009, and that really re-energized the coalition, and really back in 2007, when we started the state-funded program, the actual Lifespan Respite program, through the state funding that we had received, we identified 3 specific tasks through a coordinated statewide effort and a needs assessment. And those 3 things are: we wanted to do a better job of assessing caregivers, we wanted to create an awareness of why they were important and what they brought to the table, and also create in conjunction and in alignment with the requirements of the grant, we wanted to create a no wrong door single access point for caregivers statewide in Arizona. So as we started to work through those 3 projects, initially using the state funding and then picking up with the grant funding in 2009, it was a process that, like many states that have been through this, started with the reaching out process of just trying to bring the various populations together and getting them to the table at the same time. And while we had started our ADRC process, and we were able to piggyback on that a little bit with Lifespan Respite, it was a separate process, and it takes some time, quite frankly. But as we move forward, the efforts towards those three things really culminated last year in 2011, in that we had developed over a 3-year span a caregiver assessment tool. And in 2011, I'm very proud to say that that was implemented and required for at least initially in the aging network through the area agencies on aging. All the caregivers that are going to potentially receive respite are assessed through the caregiver assessment tool. It's not necessarily a requirement to receive respite, but it does enable us to create a database of information that we can use down the road, and does have a pre and post component to it, so that we can actually get some data on the effectiveness of respite. So we're really excited about that, and we're hoping to expand the use of the caregiver assessment tool with some of the other populations coming up, and I'll talk about that in a little bit. We also, many of you that were here last year for the Lifespan Respite Conference, were actually able to see us launch our awareness campaign, which you can see on the logo there is Give Caregivers a Hand, based on the simple idea that we should be praising caregivers for what they do, and we should be supporting them. So 2 different ways to give them a hand. And we've been really happy with the campaign, and we designed it on purpose so that it would be sustainable. In essence, we could pull it off the shelf whenever we really wanted to do something and get word out. We didn't have to really go back out and redesign it, because it would really apply whenever we wanted to apply some resources to doing outreach. Excuse me. And also, obviously, we were honored to co-host the national conference with Arch, and that was clearly a great success for us here locally. And I think it was a good event for everybody that attended. But it really helped elevate both the program and the coalition, and really showed folks here in Arizona, quite frankly, that even a grassroots organization that wasn't a nonprofit yet or anything could pull something off of that scope. And so I think it really has helped us going forward. Let me go to the next slide, Jill. Thank you. Now, the final of the 3 things that we identified, of those 3 things back in 2007, was that single access point, the caregiver resource line, as we've called it here. And it was always seen as a critical link and connection to the ADRC project here in Arizona, which is known as AZ Links. And so we've been able to do that. We're really excited about it. It's taken us a little bit longer than we thought, but we did just launch the Caregiver Resource Line on August 1. It's based on volunteers. It's actually based exactly on our SHIP hotline, which has been in operation for about 10 years, I believe, and where folks call in to a statewide toll-free number and leave messages when seeking information about Medicare. So we basically did the same thing with a little bit of a tweak, because our line is actually answered live during business hours. Here at the Division of Aging and Adult Services, we've carved out a couple of workstations, and the calls are either answered live or returned from a message from volunteers that were recruited and trained by the Caregiver Coalition here in Arizona. And we were able to, through our grant, develop the curriculum for that training in partnership and with some help from Westchester County in New York, and a curriculum that was put together by Fordham University. And we adapted it quite a bit, quite frankly, and through some really great partnerships in the community. We had, I think, 8 or 9 modules to the training. It was 16 hours, 2 days, and we had 9 community partners. Each volunteered to handle one of those modules of the curriculum, usually within their expertise. Agencies like the Alzheimer's Association and hospice agencies and the Division of Developmental Disabilities, of course, and each had different components of what we thought was required training for these volunteers to be prepared to really help caregivers when they called in. The purpose of the line is not to be a case manager on steroid. I guess it is kind of like options counseling. I've been talking to our ADRC person, and it's really developed to be something like that, something similar to options counseling for caregivers. And it's really about connecting them to resources, active listening, compassionate listening, which is really what a lot of caregivers really need, as we found out. So far, we're only a couple weeks into it. It's been very, very successful. We've been able to get a lot of good press and a lot of newspaper articles, and we're very excited about it. And because of the partnerships, we really feel it is a sustainable model already. The only piece that really requires funding at this point is the volunteer coordinator, which has been, up to this point, funded through our Lifespan Respite grant. Should we be continued with another grant, we may continue that short term. It may also come from our state general fund, which we're hoping will return some of the Lifespan Respite funds that we got in the past as we advocate for those and we start to come out of this fiscal crisis that we've been in. And you can go to the next slide. One of the things I've mentioned about the last slide too is besides the training where we had all these partnerships and folks help out, we had one of our fiscal partners for the coalition, the Foundation for Senior Living, actually pays for the actual phone line. It's not a very expensive endeavor per month for these 800 lines. And then it's just forwarded to the state offices where the volunteers actually work. But one of the bigger pieces that potentially may play a part in this, and I say may because we're just not sure yet, but the state of Arizona is actually in the process of purchasing new software to run our aging program systems. And part of that potentially may be a new INR system that uses a resource database. And if that all comes to fruition, it's very potentially possible that our workers, our volunteers that are working on this line, they have a form now and they ask these questions, and we were going to develop a database to store this information, but we may actually be able to incorporate that right into our overall system, which would really be exciting because we'd really be part of our ADRC system at that point as we did this INR system for caregivers. Excuse me. So as we move forward, because that really brings us up to where we are today, and our key element, and this really goes back to what Roseanne was saying earlier, we've identified the next two key things for us to do. Number one, for sure, is to create a statewide voucher system that really fits and works for caregivers across the lifespan. We really feel that that's a way and an approach, and I think Oklahoma validates that by creating that simplified system of access, not only of how to find out about them, which we hope the Caregiver Resource Line will do a great job of that, but also how to actually get the resources and get some respite. By having a voucher system that makes it consumer-directed, it simplifies the process, would really coalesce our efforts across the board to create this new system, and we really think it's the right piece to move forward. So that's what we're going to do, and to that end, we really identified that we had to get funding in order to serve all those populations across the lifespan. And even though, I have access to some funding through the Older Americans Act and Title IIIe, and we've read the funding guide that Arch has put together, and we've had conversations, we didn't have specifically identified funding that would cover, birth to death, in essence, as far as care recipients. And so one of the messages I'd like to share with folks is that some things happen in strange ways. And one of the things that I've been involved in for a number of years, prior to even Lifespan Respite, my involvement in Lifespan Respite, is I was identified to serve on an early childhood task force within the Department of Economic Security, mostly because of my relationship and grandparents raising grandchildren and the Family Caregiver Support Program. And it was relationships in that organization, in that group that met quarterly, that I met this person at the Office of Children with Special Health Care Needs, which is in a completely different department. It's at the Department of Health Services. And so in our government, that's 10,000 employees away. So it's not necessarily an easy connection to make. but we did make that connection a number of years ago, and as our program developed, and this person that ran that office recognized the value of respite, because she was actually a parent of a child with special needs herself, she stepped up and actually offered us funding on a carryover basis 2 years ago, which we had to turn over because it wasn't sustainable. And then last year came back again, and actually about 9 months ago. And since then, we've been able to develop a 5-year agreement, which we just got our first purchase order, and we'll be able to get somewhere between $150,000 and $200,000 a year to serve children, care recipients, caregivers of children birthed through 21. So it's very, very exciting. Excuse me. And you can actually go to the next slide, Jill. And as you saw on the last slide, really our strategy was if we're going to really have a system that is sustainable, it has to serve all the populations in order to get the various agencies and populations that are serving them now to really step forward and see that this has viability. So our initial strategy right now is to fund the birth through 21 with the, as we call it, OCEAN funding, the Office for Children with Special Health Care Needs, and then cover ages 22 through 59 with either our Lifespan Respite funds through the state allocation, should we get it back, through the federal grant, should we get that, or also in that middle group, we can use 3E somewhat, and we have some other grant funds that we're looking at potentially using also. And then, of course, over 60 recipients can be covered by 3E and state general funds of some respite funds that we have currently through our state general fund. So it's not a lot of money. It all cobbles together into somewhere between $700,000 and $1 million a year. And we're just getting ready to sit down and work through the procedures and how we're going to do the fiscal end and those critical things that Roseanne talked about. But it's really an exciting time in Arizona because we're really looking to, besides the vouchers and creating that system, if we should get funded in the sustainability grant through Lifespan Respite, which would give us another 18 months of money, and we've budgeted in looking at an online registry, which would be that final piece that helps the families connect to resources once they've got some money and they've got the knowledge of the programs through the caregiver resource line. It'd be great if they could have some assistance in finding, if they don't have a family member or a neighbor that they've already identified, that they could find good quality folks through an online registry that we would develop through Rewarding Work, through a partnership with Rewarding Work, who's been very active on the East Coast but really doesn't have many clients on the western end of the country. So that's kind of where we're going and how we're planning on keeping it sustainable. You know, I think the best part of my message is that by truly having your program serve the lifespan is really where you can get that broad-based support that can equal sustainability. And even though we've been really lucky and excited in Arizona to implement some really wonderful things in a short period of time, and we've done a lot in a 5-year period, you know, all of that work only becomes system change when it's sustained. And that's really one of the things that I learned from my mentor here at the Division of Aging, that's what we're really after is how do we change how we do business in beneficial ways. And that's really what I've been trying to do with all of our partners here in Arizona. So thank you very much.
Wonderful. Thank you so much, David. That was really exciting to hear about those solid partnerships that you've developed. This is David's contact information. It was inadvertently left out of the slides that you received via email earlier today, so we'll be resending this, and it will also be up on the archived webinar as well. We're going to move ahead now to take some of your questions. Some folks have already started writing in those questions. If you want to go ahead, and we'll give you a few more minutes to keep writing, and we'll take the first one. But before we take the questions, I do want to remind you that when you close out of the webinar, there will be a pop-up evaluation that we invite and encourage you to complete so that we can be as responsive as possible to your suggestions regarding future programs. Let's move ahead with some of the questions. Emily will read the questions that have been typed into the question box, and we'll go ahead and take some answers. You want to go ahead with that, Emily? Thank you.
Yep, absolutely. The first question I have is for Susan, and she asks, can you please elaborate on the central website and the phone contact point that has been created for the families, and who is hosting the service, and how are you sustaining it? Susan, are you there?
I just got back. Sorry. I managed to disconnect.
Okay, the first question was for you, Susan, and I'll repeat it. Can you please elaborate on the central website and phone contact point that's been created for families, and who's hosting this service, and how are you sustaining it?
The Respite Coalition is hosting that. And it is our website and our phone number. We call caregivers back. We call providers back when they want to volunteer or whatever. So it is contingent on the Respite Coalition having staff and volunteers willing to answer those calls. And it is not really 24 hours, although we do, call people back in the evening if we didn't get the call in the daytime. So.
Okay, next question.
Next question is for Roseanne. Since much of your funding is provided by state agencies, is the ORRN able to do any budget advocacy, and are your activities constrained at all due to being state funded?
We're constrained only by the fact that when there's money there, we get it. And like I talked about, we'd been through some pretty tough budgeting issues, and we did lose mental health for a while and health department for a while. And I think until we get back up and running without OASIS, the health department and mental health may be willing to come back in when we figure out how to have that contact, that one-point contact again for them. Does it provide us any constraints? I don't think so, because it is one of the more, in the long run, it's a stable form of funding. And by providing data to those funders and showing how the money's spent, who it's spent on, and the cost efficiency, for the first 10 years, the average cost per respite was less than $6 an hour, with families negotiating the rate of pay. So we were able to show that if you went to an agency in Oklahoma, the minimum cost was going to be $14 to $15 an hour. So people were able to buy more by being able to use a family member or a friend, somebody from their church. We didn't question all of that. So do we touch base pretty consistently with the people who fund us? Absolutely, because we want them to know what the benefits are. Does that kind of answer your question?
I think what she also might have been getting at is, are you constrained in your advocacy efforts because some members of the Oklahoma Respite Resource Network might be state agencies?
We have never had anybody say that. We have been able to go to our partners within the state agencies and pretty much speak our mind, because we're not preaching some kind of radical, even though we talked about taking over OKDHS in the beginning, we're not talking about any radical thing. We're presenting, we had to do a lot of educating in the beginning, and so we still see that as our role, is educating. And when people have the right information and the right numbers, now you've got to be honest with people. You can't hedge figures and you can't do that. But I don't think any of us ever felt like we couldn't advocate openly for respite care and for families and caregivers.
Great, thank you. Next question.
This next question is for David. David, are you willing to share the revised training curriculum that they devised?
Yes, we are. We're not quite ready to share yet because we just have to clean it up, and we were actually finishing the curriculum the day before, as you might guess, before we actually did the training. But certainly, yes, we do intend to clean it up and package it and share that when we'll share that through Arch, I'm sure.
Great, thank you. Next question?
This isn't directed at anyone specifically, but what do you think about care.com as a source of providers?
Well, this is Roseanne. I don't know anything about care.com. So.
Perhaps we should let WC answer that.
Yeah.
We have a lot of families that are using the service. Care.com is basically a finder service for families. You can look for babysitters, ABA therapists. You can look for aging caregivers. But the nice thing on it is you can actually go in and type in specifically what you're looking for, whether it be somebody who works with disabilities or whatever those pieces are. There's a $35 fee, I think it is, for a month. So typically our families are looking for a caregiver, are looking at one period of time. You can go in, you can look at all the different all the different caregivers who are in your area, but then if you actually want contact information for them, and they all have background checks, you have to pay that $35 fee. So I think it's there. I think it's a helpful resource for families. It's got all the little bells and whistles. But I know like Arch has a resource to find your caregivers. You know, other states have got typical pieces, but you know, it is a for-profit business, but they do treat it like a nonprofit, and they've made a lot of exceptions for people with disabilities and with the aging population. So it's a pretty slick kind of program.
I do also have to say, this is Jill, that even though we have a wonderful respite locator service on our website, we are working with care.com and with rewarding work to supplement what we can provide on the respite locator. And we hope at some point, if you're an Arch member, you'll be able to access care.com at a reduced fee. And they're also willing to work with states to develop reduced fees for their services. So they do offer, you know, the individual providers that many other respite registries cannot provide. And they do cover all ages, not just children.
And this is David, and I would just add to that, since I mentioned we were looking at doing an online registry, that we've had some back and forth with care.com, and actually our volunteer coordinator that runs our caregiver resource line has actually been a working caregiver on care.com and has given good reviews of that process. But I think the point is that I don't think there's any one best way to do it, and I think that one of the things that one of the approaches we're going to do is to try to provide as many resources. One of the things we like about partnering with Rewarding Work is their approach holistically across the different populations and how they can customize a website that can work for the DD population or for the Medicaid population and for the general population that's just families out seeking help. And we can tie in the state-based registries that already are created that are identifying perpetrators. You know, the Adult Protective Services Registry and the Child Protective Services Registry are out there, but folks don't know how to access them. So, you know, it'd be nice to be able to get people to be able to tie into those too. So we're going to try to do that in the one no wrong door approach again that will be tied as part of the umbrella of our ADRC project and part of the caregiver resource line. We'll all be connecting to this online registry process too.
Great, thank you. I think we have time for one more question, Emily. Go ahead.
This one's for David from Linda Porter in Washington State. And she says, you mentioned using a respite registry, specifically one on the East Coast. Do you know if any updates have occurred with their system to offer vetting of respite providers? And if not, how might you foresee mitigation of litigation?
Well, that's a great question, and I guess it's the 800-pound gorilla question. And I think that we've encountered that a lot, and we actually were part of a process to apply for a grant, one of the CMS grants back in February that didn't work out that way, but in that process, we were able to go out and get support letters from every major agency in Arizona towards this concept of doing this online registry. And I think part of the synergy that helped us get to that point was that we were able to kind of answer that question, and that basically the process that we were engaging in and what we were told by Rewarding Work is that we could build the website to do whatever we wanted it to do. And if we wanted to tie it on a vetting basis to, for example, we developed a direct care workforce curriculum here in Arizona in the last 3 or 4 years that's being adopted, fairly widely across the state in different organizations. And I think that, one of the things we're hoping is that we can connect people and we can use the registry to say that here's a list of people that have, done this training and provide them. And we're not going to we don't want to limit who folks can hire because that doesn't work very well either, but we also have to work with the agencies that do have requirements of minimum standards. So, and that's what and I believe we're able to do that. And so I can't answer her question precisely yet, but I do believe in the process, and we're willing to share that as we move through it in the next 18 months, that is a doable thing, that you can accommodate all those needs.
Great, thank you, David. Actually, I just saw one very important question that I wanted to get out there before we close from Carrie. It's when states are using a voucher system, are the funding sources kept separate, and what covers people that fall in the gaps? And that's probably for Roseanne and David, who have their voucher systems or will have them up and running.
Well, we had some funds that were very flexible that we could use to meet the needs. That's the reason why we applied for the Lifespan Respite grant, was to provide that gap funding for those individuals. And what was the first part of the question? Sorry.
It was, how do you actually keep those voucher funding streams separate from each other, tied to their individual eligibility criteria?
Well, everybody that uses our funds that's outside of the Department of Human Services actually does a contract with DHS, and we create a fund for them within the system. So each fund is given a number so that when we issue a voucher, it comes out of the particular fund that it's supposed to. That's the down and quick and dirty answer.
South Carolina is using some voucher money. We are giving vouchers, but it's only right now with the Lifespan grant money. And we are targeting, we aren't exclusively doing, but we are targeting that 18 to 60 age group that has no other funding. It's hard to find them.
Yes, it is. Yes, it is.
They're not used to asking. They're not used to it being there.
And I would add that that's the target population we're going to go after with vouchers, but we're also going to look at a new, maybe not new, but one of the things we really are hoping to do is create a different type of voucher besides the respite vouchers that for emergency respite and regular respite. We're hoping to create a training voucher that'll allow caregivers to get caregiver training. It'll be short bursts of respite, maybe 20 to 30 hours, that will and can be used in a consumer-directed way, but it specifically enable them to go to an evidence-based intervention like we've done with our Care Pro in Alzheimer's disease, supportive services program, or other significant evidence-based trainings, and in really trying to connect those two services in a meaningful way.
Excellent. Well, this has been a very, very excellent webinar. Thank you to all of our speakers who joined us today and all of the participants who stayed with us. Again, this webinar will be archived on the ARCH website, and you will receive information about how to link to that. If you have additional questions, please send them to me at jbkagan@verizon.net, and one of us will get back to you. Thank you again for this wonderful webinar, and we hope to see you all at the next one. Thank you.